I'm the Chief Health Officer for Salesforce, Dr. Bryan Tan. Have been working with Salesforce all throughout since the COVID response. So we've been working with the ministry here ever since, even before the COVID response, but we were being used very meaningfully as part of the contact tracing work that was being handled over here, the vaccinations as each individual consumer was booking their vaccine appointments, and the workflow for a lot of the vaccination program is on Salesforce. Since then, we're the Aotearoa immunization register for the entire nation. A number of the infectious diseases have also been added to the surveillance capability. Things like rheumatic heart disease is being tracked on Salesforce. And there's a host of regulatory kind of practice use cases as well being used in Salesforce. So Salesforce has been helping New Zealanders for a while now, and we're here to stay in a meaningful way, and we're here to help.
Great. And you presented here at the conference. Tell us a little bit about that.
Oh, it's been a pleasure actually to hear all of the presentations and also have a lot of great conversations and catch-ups with the people that I've met over the years here at HiNZ. What we presented was what are some of the global headwinds in health? What are the challenges that health systems both here in New Zealand and everywhere are facing at the moment? And it's striking how similar those challenges are. Some of the thematic consistencies here in New Zealand, across the states, in Australia, in Canada, a lot of our nationalised health systems are facing a threefold challenge in terms of budgetary constraints and the overall government ability to spend on budget, but then its impact on health specifically as well. Global workforce shortages and how they're playing out across all of the patches. And that's creating a mathematical impossibility. It's resulting in things like lack of access to GPs at the front end of the line, and then further upstream or downstream, the way you see it, ED ramping, so backlogs of patients waiting in the emergency departments, backlogs of elective surgeries globally as well because of some of those global shortages and lack of resources as well. And then thirdly, the shift towards consumer centricity and the rise in consumer demand. So we do a lot of intergenerational research with healthcare consumers here and around the world, about 16,000 of them. And what we see is a definite shift across the generations, but particularly so with the younger generations towards democratization of their own decision-making in health and self-information seeking before they even seek the advice of a healthcare practitioner. So a lot of breakdown in the old hierarchical models of health. And that then has downstream impacts on the culture of clinical staff and how they provide care, how they talk about care, how they involve the consumers in decision-making as well. And then the systems and the technology required to support that changing culture as well. So 3 big shifts: budget, workforce, and then the shift to consumer is global systematic themes across all the health systems that we help.
Fascinating, thanks. I'd love to hear a little bit more about how Salesforce supports the infectious diseases surveillance. How does that work sort of in the background?
Yeah, so we're the registry for, because we're a bit of a Lego set, we're not just a single point app. So when it was deployed for COVID contact tracing, for example, the fact that the platform is so highly configurable and it's actually Lego pieces that you can build together, it's a logical extension then to not only serving one pathogen in COVID and coronavirus, but then also potentially for rheumatic heart disease, for monkeypox, and any new pathogen that's going to come along, and you need to skill up new care pathways, new protocols for care specific to disease groupings in infectious disease. It's easier to put it on a loco platform where you can craft a new workflow within days, not months. So that's really the value of the new technology that's coming along. In a low-code studio environment, you can roll out a lot of these solutions far quicker than you ever could, which is a revelation for a clinician like me who's used to, say, 10 years ago having systems which say 3-year-long projects as opposed to 3-day-long projects. That's transformative. That is truly revolutionary and eye-opening. We also serve the New Zealand public in terms of the integration piece, and integration is one of those gnarly problems in health that has been around ever since we've had technology systems in place with different proprietary data models in the back end and then also different configuration of workflows. How do you build better connectivity so that clinicians working in primary care, secondary care and tertiary care can better communicate and coordinate with each other without necessarily the direct conversation or the benefit of being able to yell across the hall, "Hey, can you take a look at patient in bed 21, please?" But now working in patients' homes, community centres and that shift left, how do we still enable good, effective technology that helps you with that instantaneous communication and collaboration and coordination. So that's also a key part of what we're trying to provide. Through the HiNZ project, we play a big part in the spine of that ability to talk between the subsectors in health, between clinicians at the coalface, allied health, being able to exchange information through HiNZ.
Well, it sounds like you're really tackling all the key points, and it's great to hear that a lot of the technology spun up during COVID times is now being able to be expanded into other important areas. I think might be used for measles perhaps as well, and we've just got a whooping cough epidemic happening as well. So it's health has always got something coming around the corner, so it's good to know there's technology there to help us track it and that we've learned from the pandemic.
Absolutely. I think the pandemic gave us pandemic privilege. So we had a lot of special situations where government regulations allowed for fast-moving, agile workflows to be rolled out. And now that the pandemic is over, I see a distinction between those health systems that have realised that there is now everything's changed, and those health systems which still believe, no, it's BAU, we're back to normal. Those health systems which still think it's BAU will not have leveraged the learnings from that pandemic privilege. But those health systems that have realised, actually, we've got new tech now that we can deploy new workflows. If we need to change things, we can quite quickly, at speed and at scale. Those health systems are where I see there's going to be much faster trajectory of progress and advancement of the ability to use technology in the piece. So we're looking for those kind of health systems who are forward-thinking that way, have realised that everything's now changed, including the tech. I mean, really, AI is on everyone's lips. At Salesforce, we're focusing on agentic AI, which is the next evolution beyond co-pilots, and the ability not just to suggest back what the next logical course of action is and provide some decision support with human at the helm, but instead to actually enact some of those actions as well. So in the process of following up a patient, say post-cardiac stent, not only suggesting, get in contact back with your GP and try and ensure some follow-up, but potentially to actually proactively send out a message to the GP saying, are you aware your patient has already been discharged from hospital, and send a proactive engagement journey to the patient themselves as well, or their carers, depending on the information that you know about the person. So that agentic AI capability to not only suggest, but to act is what we're excited about for the next future. And it's going to be highly important as we need to do more with less globally. So we're trying to see how that agentic AI can be brought to bear in a really valuable way for health as well.
Great, and certainly I've seen the very busy booth sessions, so people are keen to hear about that agentic AI as well, so it's great that...
We had a silent disco, so I think everyone saw the headsets and thought, let's take part,
Great. Oh, well, it's been fantastic to have you here, so pleased that you've added to Digital Health Week NZ, and kia ora.
Kia ora, thank you.